Ooh, I don't know how you follow that. But we got an idea. Superintendent of Education, John Fernandez. Good morning, John.
Half a day and good morning.
Um, Good morning.
Where do we want to start?
Let's just start with positives in the with students attending GDOE schools. Man, John, I'm sure you're well aware the level of fear, frustration, anger. I mean, it's really reaching a boiling point with these parents.
Yeah, and so I understand. I definitely understand the fear and the concern. I mean, generally, with the community and with the numbers that we're seeing, we like everybody else, we track the community numbers, and then we're tracking our school numbers. We're tracking the number of kids who are vaccinated on the island, and just try to we're educators. We try to look at data to inform to inform us about what's happening in our schools, and also to give us give us information that we can then use to make decisions about how to move forward. So I would agree. I mean, if we look at what we're looking at, the 7-day positivity rate, it's at 7.6% compared to being below 2% in during the best of times, and you've got 372 new cases a week, per 100,000 residents. That is definitely 3 times higher than what we were tracking in August. So generally speaking, we understand because it's a community-wide issue that's going on, and we really hope that the governor and all those who are making decisions island-wide are able to really figure out how to successfully support the community in containing the further spread and the further impact on our healthcare system, which I think is what's driving a lot of these issues, knowing that the hospital beds and ICU spaces are filling up, and there's an inability to take care of additional patients who are coming in during this time. So when it comes to the schools, we've been very forthcoming and transparent about the numbers that we're seeing, and so every day in the JIC report you will see a report on the number of students within or employees within GDOE who have tested positive. Usually when the report comes out in a paper or on the news story, it gives you the entire total. So you might be hit with a number of maybe 12 or 8 students in GDOE are positive, but we're tracking this, and we provide it in the Joint Information Center reports on a school by school basis, because what we're really looking for is we know that there's a likelihood of given the cases out in the community, over 600 active cases, we know that there's a high likelihood that that household has a child who may show up at school and later on be identified as a positive, just based on contact tracing from the case or whatever situation happened to affect that household. And so we anticipate that those cases may show at our schools, and that's what we're seeing. If we look across the school system, we have 20 cases in our elementary school system. In our elementary schools, we have our 24 cases in middle and high schools. At the most, we're seeing, Untalon and John F. Kennedy with 4 cases each, and then of course at the lowest, we see 1 case at many of our schools. We're looking at these numbers in comparison to the in-person enrollment, the number of kids who show up every day at school, and that percentage is really low at the moment, meaning 1% or less than 1% for most schools. I think the only school that's hit 1% is Liguan, but that's because it's a small population to begin with. We're tracking that, and as every case comes through, working closely with public health to ensure that contact tracing is done, parents are notified, and then we go through the quarantine and testing procedures before any student or any employee is allowed to come back to school. What we're really watching for, and I think this is the important issue, we anticipate that we'll see cases, and our job is to prevent any risk of spread from a student to another student, from a student to an employee, and so forth. What we're very pleased to know at this point, I mean, even within this overall public health emergency. What we're pleased to know at this point in our work with public health is that all of these cases, all 44 of these cases, are traced back to an incident or an index case outside of school, and there is no evidence at this time of any spread from student to student, student to employee, or vice versa. Right. And I think that, the way we identify spread is, a couple of ways. One is we start to look at, for clusters of cases at any one school to see whether, if there's more than one case, how are those, let's track those cases and then work with public health through their contact investigation to determine if there are any links between, cases happening at the school, so that we can determine whether there is any potential spread, within the school facilities. But at this point, what it looks like is what we're doing at school is trying to fend off cases that are coming in from the outside, and our strategy to fend off these cases is to implement the safety protocols that we have at school, from universal masking, hand sanitizing, and so forth, physical distancing. What we've done this week, because I know we had a lot of concern about the protocols in place, is we just told that we just invited Director San Augustine and his team to come visit schools with us, because we're already visiting schools to see what's working and to identify things that are challenging to the schools, to determine what we can do to support the schools. And we've already been to several schools this week, and several visits planned for today and the rest of the week as well. Chima has been there with us, their CDC representative, their containment unit director, their deputies, and Mr. San Augustine director at the director level. We've walked through, we've seen, the classroom situations. We watched the students during their break times, during lunch. And, I think it's just important that we have a good understanding and a first-hand understanding of what's going on in the schools as we determine, what to do going forward. So that's what we're doing at this point. And then also, because we've received a lot of information, it's really difficult. I think I mentioned to you before, in a short article or news story, hard to really convey all the information that is available, and also hard to interact with our constituents. So we are hosting several forums for our employees and for the general public this week to be able to explain our take on where we are today and what we're considering as we look ahead. Also to get questions and comments and suggestions as well. We started with our school nurses yesterday, because they are on the very front line of all of these responsibilities. We are moving to our administrators this morning, our elementary leadership teams, and our later today, our secondary leadership teams tomorrow, and then on Saturday, a general meeting for the public, mostly for parents interested in, again, hearing where we are and trying to understand how we are assessing the situation. Mm-hmm. So those are the ways we're trying to engage our community and give them our take and our view of what's going on in schools.
John, the governor holds a press conference last week on a Friday late in the afternoon, and a majority of the comments are about GDOE, because parents have been seeing the numbers continue to climb. And albeit you're saying that it's not being transmitted within the schools, even when you're not on the show, John, people are commenting about GDOE. Shut down the schools, shut down the schools. We're at 44 students that have tested positive at GDOE. At what is the trigger? Where you say, I'm going to shut down the schools, or I'm going to move and do some sort of
contingency plan?
Yeah.
Because obviously, John, the number one thing is parents are saying that they're being punished with truancy because they're afraid to send their kids to school. They're saying they're not being afforded an option to do the online or the hard copy or whatever, other than face to face. And it is just so widespread. I mean, everywhere I go, parents are just freaking. And I get what you're saying about there hasn't been evidence of the transmission in the school, but this surge is so widespread in the community, and the community works in the schools. The kids are, you know what I mean. So it just seems to me like when you say the data shows this, that really is just a snapshot, and we know that all it takes is one Okay, so what plans are in the works, and how are you addressing all the million concerns?
Well, again, I understand the fear in the community, and when we're trying not to make decisions just based solely on the fear that's out there. Otherwise, we'd be shut already. Just as you know, just to make sure that everybody feels comfortable, knowing that schools are closed, even if the cases are not coming from the schools. Mm-hmm. And we're not operating that way because being in school is important. If you go to the schools, you talk to the students. At every level, you ask them, how they feel being back in school, how they feel about moving back online, moving back to cohorts. Our kids want to be back in school. There are reasons why it's important that they be back face to face. We're doing everything we can to ensure their safety as well as their opportunity to continue in-person learning. But of course, safety is the most important thing. So we're basing our assessment on what we're talking about, not just a snapshot. We're looking over time, from the start of the school year to where we are today. What are those cases that we've identified? Have any of those cases been linked to any other child, any other employee in our schools? And if so, that's when the red flags go up, and we start to look and determine whether we can contain, that, or whether we need to move to another mode of learning. In most states and jurisdictions, I've seen the same type of assessment and monitoring. Usually, you're at the 3% to 5% level before we see some of these other districts starting to move to a different model of learning. So we're looking at a similar range as a level of concern. And of course, as we approach that range, we're focusing on those schools. We're going to focus on those schools that seem to be moving into that territory. And again, the important part is working with public health and understanding the issue of whether any of these cases that we're seeing are linked. We did have this conversation with them yesterday, and we wanted an assurance that we're not going to look at these things and get a report a week later. The minute that they see a link, we need to be notified so we are aware and we can take immediate action, at that school if necessary. Yeah. So, I think the other thing that we have to do is continue to engage, our families. It's kind of tough. I think it's really tough this first week. It's tough to do it through even this, this mode of, working through the media. We're trying to figure out ways to directly communicate with our families as well. And so we'll see how this Saturday goes. And we'll see, we'll have a lot more data by then. We'll have a lot more information on what's happened to those those close contacts who were quarantined and tested as part of the initial cases that were reported, and really share what our thoughts are and what our approach is, as we look ahead and continue to monitor these cases. At least kind of share what's going on behind the scenes in terms of the thought process, the monitoring, the communication and collaboration. Behind the scenes, there is a lot of activity, going on. Our nurses are, really on high alert. They're working closely with the administrators, with our social workers to contact parents, with central office to make sure that everyone's, on the same page and that guidance is provided should there be any questions. So behind the scenes, a lot of activity, and of course, a lot of concern. Everybody's concerned that we try to nip this in the bud in terms of the school safety. But again, we understand a lot of uncertainty out there, and maybe not a lot of confidence because people don't know what's happening behind the scenes. And we want to share what we're looking at, share what our process is, and our preparation for other scenarios. And hopefully, this weekend we can see whether that will help. Those who participate and get a chance to be a part of that conversation.
Is this operations in, was it Kasu?
Well, we have a debate going on between our Chamorro teachers. It's either, it's operations in Kasu. Our board member, Maria Gutierrez, I think she's, from the, throwing in the CNMI version, she's Operation Zangin in Kasu. But Well, what it really means is it's our backup plan. It's just in case. Is what it is supposed to mean literally. And what we're doing is, obviously throughout this pandemic, we planned for alternate scenarios. What we're looking at now is, in the event that we have to shift operations, what are the options, and are these already, and can we clarify, the operational shift that will be needed at every school. So we wanted to make sure that we worked with all of our schools to ensure that they were updated in terms of their plan to shift if needed. And what we're thinking through right now is, again, it really depends how this occurs. If we're talking about one school where we see a cluster of cases that gives us evidence of spread, and we decide to address that one school, the opportunity to go back to cohorts and limit the number of children on campus is definitely a plan that is being put in place. And then the other is, if in the event that we need to close and shift online, making sure that all the plans are solidified and updated in the event that that happens. So we're doing it on a school by school basis because those situations could happen where only one school is affected and the other schools are allowed to continue operations. But they also would be relevant in the event that the governor says, the community situation has gone so hot, so precarious, that we have to shut the schools down entirely, and every school has its plan ready to activate in that case as well. So again, this is something that we've been working with schools on, just to update and to make sure that we're all on the same page as we monitor the situation. And then when that time comes, and if that time comes, those schools will be prepared.
So, I guess while we wait for the governor to address the transmission of COVID, what is the trigger for GDOE to implement this operations in Kasu?
Right. So, like I said, there are two ways. There are two scenarios we're talking about here. One is if it's a school level, an individual school that's being affected based on the incidents that we're tracking. That's something that I know that the governor has left to us to be able to address, without her having to take any executive action. We have the ability to act in an emergency. And if that becomes the case, and we see those numbers move at a school that worries us and concerns us, we definitely have the authority to do that. So like I said, there isn't a hard number. We're looking at that 3 to 5% range as being a red flag, at which point we need to determine very closely with public health whether those numbers are indicative of spread within the school. And if so, then that is sufficient for us to move into implementing a new plan. I mean, the operations in Kasu for that situation. And again, that's based on the incidents, and that's why we're sharing the information that we have at schools with the public, so they can also track alongside us here at the central office and at our schools. The other scenario, of course, is if the numbers go so high that we spend all our time trying to fend off these outside cases, and the governor decides we just need to maybe put this on pause for a while, then that would be another scenario in which we would expect the governor, in collaboration with public health and myself, to do maybe a district-wide measure that affects all schools. So we try to just clarify that to our communities. It is possible that one school could be affected. It could be possible that at some point it's so general that the threat is so widespread that all schools are affected. And we will communicate with our community and let them know where we are, in the process of evaluating those decisions.
So if there were 10 positives at, let's say, Untalon Middle School, is that enough to be like, let's implement operations in Kasu?
Well, if we get 10 cases at Untalon, right, and we start, and again, 10 cases will get you above 1%. Obviously we're going to be tracking that in the larger schools. Even before we hit that 3 to 5% range, and you know, just like we did yesterday, we were at Untalon yesterday, and of course the conversation there was, we have 4 cases. What is there any link? Are you able to tell us more about these cases? And public health has been forthcoming and letting us know, you know, that these cases are associated with particular gatherings that they've been tracking in the community, and that at this point there is no link between those cases. So whether it's 0.5%, 1%, we're going to continue to have that conversation. But as the numbers grow at one school, you know, if we see those numbers really spiking at one school, and you know, that will definitely, you know, get the most attention. And right now we see kind of a wider spread and a very low percentage. Public health again is on, you know, they've been on notice to notify us should there be any links between cases that we need to be aware of. But again, as we see these percentages grow higher, it will be more concern for us, not just because we think they're spread, but at some point, if we're seeing the number of cases impacting the schools, you know, especially at one time, and it becomes harder for us to operate, and you know, if we're spending all of our time contact tracing and sending kids home and quarantining teachers, it becomes an operational problem for us. And at that point, you know, we will need to evaluate whether we go to you know, Plan B and Plan C.
Does every school have a nurse on campus?
Every school does have a nurse, yes.
Does every school have a counselor?
Every school does have at least one counselor, usually more.
And you know, during when kids weren't going to school, we were all talking about the mental health of our children and the anxiety, but now kids are in school and we're starting to see positives. How is the mental health of our children? Are they worried? You know, are they experiencing, you know, anxiety at school? And are they going, you know, acting out or talking to the counselor about this, or their teachers?
Right. I can share. I mean, it's been about, you know, a week and a half of, you know, almost 2 weeks of school, and I can share just anecdotally. At this point, I don't have any real data behind it, because we've come into a school year where there's already a heightened sense of anxiety and uncertainty, not just about reopening, but also because the cases have increased. I think if you talk to, and I've talked to kids at all levels, what's first of all, what's very reassuring at the school level is we used to worry that the little kids were gonna, you know, not understand what was going on, and they're gonna be hard to control and figure out how to. The elementary school students are great. I mean, I don't know if they view these protocols as a game, but they're all, you know, making sure they wear their masks. They're telling each other where they're supposed to sit, where they're supposed to walk. And I was very surprised yesterday at the school to hear the level of conversation at the elementary level. I do think that there is an impact from what they're hearing and a lot of it hearing at home as well. There is definitely an awareness of COVID-19 and the anxiety that's in the community, because you see that expressed. I mean, they're happy to be back in school. They're happy to be back with their friends and their teachers and their aides, and they express that. They are very familiar with all the safety protocols. I mean, they're using words like quarantine and vaccination, and, you know, things that you might not expect in a third grade class. So you know the conversation's out there, but you can hear in their comments some of the things that, you know, are probably mirrors of what they're hearing from the adults or their, you know, maybe siblings in the household. So yes, you do hear that, and you can only imagine that, of course, it's going to impact, you know, especially our younger kids, if they are fearful or scared of coming to school. I think right now you do know, though, you can tell that the conversation is happening very actively at home. They're picking it up, they're coming to school, and they're sharing it. For the older kids, there is the high school kids that I've spoken with, they don't want to go back anywhere online. I think part of it is there's a lot of school activities that they would like to see happen this year. The seniors especially are saying, please tell us what we need to do. We don't want to miss out on our school year by going to cohorts or going online. But at the same time, we have to say to them that it really is your responsibility to be safe and to communicate to your classmates that what we see on campus needs to be really, you know, you listening to the rules and paying attention and practicing it. Otherwise, there's always a risk of, of having to go back to what we did last year. And at the middle school, it's kind of half and half, So I do think that what we're seeing is very, very active conversations about COVID-19 happening at home, in the community. Kids they're hyper aware of all the things that are related, the safety protocols, the risks, the vaccinations, the debate about, that's happening in the community. And I do find a lot more of our young high school students probably more supportive of this notion that, what the governor's done actually, really promoting vaccination as part of, our efforts to contain COVID-19. I just think they just don't want it to affect their lives anymore. I think they're tired of it. They want to move on and get back to school.
John, is there any conversation? There's something I heard last night. Chatter from principals at the school level about possibly doing staggered schedules just because it's overwhelming for the staff to deal with, just all the students on campus at the same time.
We've heard, we've always heard that that if there's another scenario that we might consider cohorts, right? So, and of course, when we were planning for this year, we planned it under different scenarios where it wasn't so, where the cases weren't so high, and we opted for one cohort because we're balancing not just safety, but we're also balancing the negative impact that school shutdowns have had. Or even cohorts have had on kids not being able to get 5 days of instruction. I mean, I think that's what we were discussing a few months ago, Sabrina. How many days, right? Parents were saying, how many days of instruction will my child get this year? And we said, we're trying to get to 5. And that wasn't enough because, for many parents, they understood, just like I do, the impact of being home and not having the ability to go to school 5 days a week. So we prioritized that, and that is still the priority. What we're dealing with now is in this first couple of weeks is we noticed, we know the community environment is precarious. We're watching the school environment. We know the cases are come, but our protocols are in place. We've seen the effectiveness of those protocols so far, and that gives us confidence to at least continue to monitor unless something changes in the community or at our schools that require us to shift from our current approach. And that's something that we just want to communicate to our parents and our stakeholders. At this point, we're monitoring every case that we hear. Our coronavirus emergency chat is lit up every day as we trace, work with parents, trying to get this thing make sure that there's no spread occurring. And so far, we've been able to be successful in that. However, things can change, and we're prepared for any scenario. So that's the constant struggle. It is overwhelming. I think every teacher, staff member, administrator is going to come to school with a different sense of uncertainty and anxiety because this is a different year than usual. But at the same time, we really need to pay attention to what we're seeing and what we know and use that information to guide our decisions. I mean, I do get some schools, who employees who call me or text me and say, hey, can we go to cohorts? Can we do this? And these are schools without any cases yet, right? They're looking ahead. They're scared of what the future holds. And we're concerned as well. But right now, we're really paying attention to what we're seeing in terms of the cases that are real and before us, and using that information to guide our decisions going forward.
John,
the other thing, Sabrina and Chris, that I'm really concerned about, and this is of course is the conversation with public health, is we know that kids typically are showing in our cases they're almost all asymptomatic, or with mild symptoms. But of course, we know that in other places, especially where the masks are not being required, in states like Texas and Florida and Tennessee, you're seeing their numbers of kids being hospitalized, skyrocket. We're concerned about that. At this point, in my latest conversation with public health, no children have been hospitalized. We're very, very grateful for that, and we're going to continue to do our best to ensure that there isn't the spread of this virus to other children. But again, those are the things that we're tracking to make sure we're up to speed with what's happening with this additional surge.
All right. Thank you, John.
I just wanted. Can you just provide just clarification on sports? Do the athletes have to be vaccinated? Do spectators have to be vaccinated? Is there a limit on people who can go?
Yeah. So right now, the EO that came out obviously referenced organized sports, and so we were reviewing it to figure out how that affected interscholastics and so forth. We reached out to public health and have received clarification that the organized sports are not intended to cover interscholastic sports. So interscholastic sports are going to be covered within our K-12 guidelines. So again, it doesn't mean that a decision can be made to modify both participation and spectators at sports. But right now, the executive order does not affect the interscholastic sports. So essentially, we're at status quo from where we were, earlier this summer, late last school year. We are though having conversations internally about the possibility of these types of requirements being extended to interscholastic sports, to determine what our recommendations would be and how we would operationalize it and so forth. So it is something we're discussing, but right now there's no change in the requirements for interscholastic sports.
Thank you, John.
Thanks, John.
I guess what I'm saying though is, Sabrina, is for anybody out there whose child is maybe a participant in sports, and if you've been told, because I heard some of this, that some of our coaches or athletic directors may have jumped the gun and say, hey guys, you might need to be vaccinated. Yeah. That is not the case. So for parents out there, if your child's been told they need to be vaccinated, that's not the requirement at this point in time. So you should, if there is still some misinformation, contact your schools, clarify it, because by now all coaches and AD should have that clarification from us already.
Thank you, John.
Thanks, John.
Keep us posted if you got to roll out Operation Sin Kasu.
Right. Hey, Saturday will be open and live streamed, and media can also view live or afterwards. Right. So you can get a sense of what that discussion is, and then we'll go from there. I mean, I think it's really hard now during this. I think a lot of leaders in this situation, and I can sense it. I don't envy any of my fellow leaders. It's kind of tempting to disengage, and say, hey, look, guys, we got a plan, and it's hard to take all the social media and all the phone calls and emails and respond to them and, try to keep everybody assured. But this is the time to engage, and we're just trying to figure out how we can continue to do that, to let our community know we hear them. We're not ignoring you. There's just so much going on, but we're trying to set that time up so that we can, hear from you directly, let you know what we're thinking, what we're doing behind the scenes, let you know what we're thinking about going forward, and get your input and suggestions and your concerns, so that we can factor that into our planning. So we'll get that information out, and if you could get it out as well about this Saturday, we certainly appreciate it.
Of course. Thank you, John.
Thanks, John.
Thank you.
All right. Oh, there you go, Superintendent John Fernandez. Backup plan behind the scenes, Operation Sin Kasu. It looks like it's targeted towards individual schools, and then there's also a general plan in case the community spread. Well, I don't know. I'm just going to say the community spread. To me, it's already at a point where it seems like we're just teetering on the edge of something. And then, another reason why I think the anxiety of the parents and even the students, you might got little kids and they're always like COVID's in the school, right? But what has really ramped up the anxiety, frustration, and fear from parents and the families of school-age kids is this whole conversation about the unvaccinated. when the governor came out Friday and, declared war basically on the unvaccinated, as a parent, the first thing we all thought was, wait a second, we got a school system of 28,000 unvaccinated children. So if we're going to put the unvaccinated up and say that, hey, they're the ones that are responsible, it's a pandemic of the unvaccinated, the obvious next step you're going to take in your mind if you have school-age kids is say, hey, wait a second, so my kids are unvaccinated. So I think that's, again, another reason why parents are just, and with the Delta variant, I mean, we know how contagious it is. We're hearing from all the doctors it's already here. So, wow, it's tough, very, very tough. And I know that parents, they want to see something done, some kind of change